Welcome everyone. Thank you for joining us today. I'm Teresa Marantat, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Maintain a 2-meter distance from others. Wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 158,758 confirmed cases of COVID-19 in Canada and 51,710 cases in Ontario. Chatham-Kent has 369 cases and Sarnia-Lambton has reported 346 cases. Michigan now has 124,687 cases, with 14,440 cases being in Detroit. Today, we are reporting a total of 2,664 cases of COVID-19 since March, an increase of 1 case from yesterday, which was travel-related outside of the country. 2,544 cases are now resolved, and 44 cases are active and being followed by our health unit. 1 person is in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There is 1 retirement home currently experiencing a COVID-19 outbreak. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, and diarrhea. Testing is available by appointment at select pharmacies in Windsor with specific criteria for people without symptoms. Please contact the pharmacy for further information. People with at least 1 symptom of COVID should consider testing. Windsor-Essex has 3 assessment and testing centers: St. Clair College Sportsplex, Windsor Regional Hospital Olette Campus, Erie Shores Healthcare in Leamington, and SOHAC in Windsor, where testing is available for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain home and be isolated pending your test result. The health unit will call you if you have tested positive for COVID-19. Due to access online, you may receive your result before the health unit contacts you. Please continue to visit our website at wechu.org for further information. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Yesterday we discussed the climbing number of COVID-19 cases in Ontario, and I stressed the need for all businesses to review their COVID-19 plans, make adjustments, and continue to do their part to stop the spread of COVID-19. Many of the businesses have already adapted to meet the provincial requirements and also following practices to ensure a safe work environment as well as a safe work environment for their patrons. It is critically important for all businesses to continue to review their COVID-19 plans and make appropriate changes to keep the economic activity going. While the rest of the province is already in wave 2, we can prevent this from happening in our region with support from everyone. The residents of Windsor-Essex, the healthcare workers in Windsor-Essex, the businesses in our area, the agricultural farms in our area, the long-term care homes in our region, the retirement homes, everyone. While the health of our region is the topmost priority for all of us, we all need to do our part to ensure that we continue to keep our community safe, keep the economy going, and improve our mental and social well-being. The Reopening Ontario Act sets out this requirement and guidelines for the stages of reopening in Ontario. It includes regulations and orders that were previously under the Emergency Management and Civil Protection Act. All workplaces and businesses operating fall under the Reopening Ontario Act and should be clear about requirements on how they specifically it applies to their sector, workplace or business. The Act is supplemented by guidance documents put under the Chief Medical Officer of Health of Ontario for specific sectors that must be followed and adhered to. It is the responsibility of all workplaces to follow guidance and rules set out under the Act and follow the guidance set by the Chief Medical Officer of Health. Yesterday, I was asked about the recreational facilities and activities. Rules for these activities and facilities are set out under the Reopening Ontario Act and includes limit for spectators and participants, as well as language for cleaning and disinfecting, screening and physical distancing. The Windsor-Essex County Health Unit has further guidance on our website under the workplace section of our COVID-19 homepage and covers best practice guidance. It is important to note that the guidance for recreation is specific to the activity and does not cover social activities that are combined with a sport or recreational activity. At this time, I would not recommend social events coupled with recreational events. If a social event is planned, you must adhere to requirements under the Reopening Ontario Act for social gathering, which is no more than 10 persons indoor and 25 outdoors, with all the public health requirements in place and followed. To review the rules and Reopening Ontario Act, please visit the provincial website at www.ontario.ca. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with the Windsor Star.
Yes, good morning, Doctor. Just based on what you said today, are our businesses locally doing well to follow guidance, or did they need the reminder that you put out today?
Well, I think as we have said, reported before, there were some complaints, some concerns, which we followed up, and they are, as I said, most of the part they are following that. There are situations when we noticed that the rules were not followed and appropriate guidance was provided. But I just want to make sure that we are not losing the point here is what is happening in GTA and in some other areas, and with what is at and what is at risk. Some of these businesses are at a risk of maybe for another temporary closures as well. We in our region are definitely doing much better compared to the rest of the province at this particular time, but it can change immediately. So I think the reminder and the messaging is to make sure that we are doing what we should do to keep our numbers, keep our communities safe, as the health and safety is the topmost priority. We also don't want to ignore the fact that the economic well-being, mental well-being, social well-being is also critically important for all of us. And unless we act now, we cannot prevent it. And everything that we are doing, we may see the results in the next 2-3 weeks and onwards. So if we take measures or if we do things after the fact that we start to see a surge in cases in our community, it's already too late. So the time to act is now, and I think it's critically important for all the businesses in the region to look at the policies and procedures and see how they can improve, not only what is provided to them, but based on their unique situation. What can they do better to keep their businesses safe, to keep everyone safe in their businesses? And that's the only way we can move forward and try to just work with what we have right now and keep the numbers low.
Thank you.
Any questions from Blackburn?
Just the travel-related case today, was it Michigan or outside North America, or where was the travel?
It was outside of Canada.
Okay, but okay.
Yeah, so it was not USA. It was outside of North America, let's say.
Any questions from Windsor?
Not at the moment, thanks.
CBC?
Yes, good morning, Dr. Ahmed. The Ministry of Health is saying that vaccines normally offered to grade 7 students will have to be done at clinics and doctors' offices. I'm just wondering what the health unit thinks about that move that was announced.
So,
Okay. So we have been aware of the need for grade 7 immunizations, as that is something that the health unit typically offers every year. And so with the pandemic in early March, that many students didn't receive that immunization. So we did connect with our primary care providers at that time throughout the clinic, and some grade 7 students have already been accommodated. And internally, we are trying to work on a plan that to provide the immunizations for students that require them in grade 7s. And we are not quite finalized, but we are trying to look at offering that service as well in conjunction with any students that are able to attend at their primary care provider.
Thanks, Teresa. Is this because of the strain that's on the health unit, or is it because of the split system that's happening right now? Like, what's behind the decision to do this?
The decision to do immunization for grade 7 students?
No, like, I mean, usually they do them in class, right? And now
Okay.
they're going.
So for our health unit, we will not be going into the schools. The schools are, it's still a pandemic, and we're trying to minimize interactions in the schools. So we are trying to decrease that burden on our local school system. And so the models that we have looked at are, a drive-through model, or maybe looking at another venue to offer the vaccinations. So it will be out of the regular model of actually going into the school and doing immunizations. And it really is based on the fact that it's a pandemic, and we want to minimize the amount of traffic flow into schools, and they have quite a bit going on right now. And we want to, they also have their specific cohorts and other challenges that we want to respect.
And usually the health unit follows up with students that don't get immunization. We usually see a number of suspensions. Will the health unit continue to follow up to ensure that, their students have up-to-date immunization records?
So we will continue to do that. And again, in March, we had progressed with a suspension process, and we're in the middle of doing that as well. So there are outstanding students that we won't be suspending, but we will be following up on that were, outstanding from the point of needing more vaccinations to adhere to the School Pupils Act. So we will continue to follow up with that. But we do still have limited resources, nursing resources, because the majority have been and still are redeployed to COVID work. So we are exploring all of these options, but we'll continue to work on the vaccine program, which is a priority for us.
Thanks so much, Teresa.
Any questions from AM 800?
Dr. Ahmed, just going back to the travel-related case, so you mentioned it's outside of North America, so I'm guessing they would get on a plane. Would the health unit have to get in contact with the airline to inform them that someone from Windsor-Essex tested positive, so they would let the other passengers know?
So it really depends on the timeline and the infectiousness period. I don't have all the details in front of me about the infectious period when this person became infectious. If that happens, we do need to connect with our provincial bodies, and then they connect with the federal governments to get the flight manifesto and all those details for who was on the plane. We haven't gone to that part yet, but if a case or if a suspect case is identified at the airline, then the process happens the other way around, and the province notifies us with anyone who was in contact with that individual or would be deemed at a high risk that requires some follow-up. So we haven't had that details yet from the province, and for this particular case, I'm not entirely, I don't have all the details in front of me to tell you exactly when the person was infectious and if it requires some follow-up from the airline. Based on the report that we haven't seen that.
Okay, thank you. And then changing gears real quick here. Yesterday, the OPP sent out a release saying they charged someone, issued a fine for breaking the Reopening Ontario Act, allowing the number of person inside their apartment unit. Just want to get your thoughts on that. Are you, I guess, disappointed that some people are still not getting the message?
Well, understanding that, people may have different level of, risk perception. People are still thinking that they can avoid that, or they don't need to follow that guidelines. And I think, as I mentioned earlier, we have been given this opportunity right now. We have this opportunity to act right now. the number of cases that we are seeing in our region is definitely, it's much better than anywhere else in the province. So we should take this opportunity and act on it by keeping those numbers down, and we can only do it if we have the support from everyone. And even we have seen from our data and even from other regions, these type of benign activities, these parties, which apparently doesn't seem that it's a high risk activity, but it led to cases, it led to spread of the disease. So I think it's important that all of us feel that we have a part to play, rather than trying to figure out a way that how I can avoid getting caught by anyone after having this party. So I think we have to be more proactive and respect what we have in place, and just continue to enjoy everything that we have at this time, instead of us moving back to a position where many of these activities were not even allowed.
Thank you.
Any further questions from the Windsor Star?
No, thank you.
Blackburn?
No, thanks.
Windsorite?
No, thanks.
CBC?
No, thank you.
AM 800?
No, thanks.
Thank you, everyone.
Thank you.